So my name and position, it's Stephen Lipscombe. I'm an orthopaedic consultant based at Wiston Hospital, and my private practice is based from Warrington Spire Hospital and the Nuffield Hospital in Chester. I decided to become a doctor. It's probably my A-level biology teacher, actually. So I always enjoyed science, biology, chemistry. Initially, I did think about becoming a vet. Spent some time with a veterinary surgeon, and it was a terrible experience on the farm. So my biology teacher, who had tried to become a doctor, but decided to become a biology teacher, arranged an attachment at the local hospital, and it was just fascinating, and it was really interesting, that combination of science, practical skills, and helping people. You see all sorts of people as a doctor. It's fascinating. So I chose orthopedics again in my first year as a junior doctor. I always knew I wanted to be a hospital doctor, and then you go through the different specialties, and orthopedics was one of the first, and really there was no going back from there. So the multitude of injuries you see, a lot of it is sort of algorithmic thinking. So you see a hand injury with this pattern, and you can offer this treatment, or you see a wrist injury with this pattern of injury, and you choose this treatment. And it was not only the operating. So many times I was called down to A&E, and you could manipulate things in A&E, apply plasters, slings, perform injections. It just really varied. And I suppose that the mantra with orthopedics is you're restoring function. And whilst many of the procedures we do are not life-saving, they are function, and without function, what is life really? I hope that's what most patients appreciate. So I grew up in Barrow in Furness in Cumbria, so on the northwest coast, shipbuilding town. First, I think I remain the only doctor in the family. Next to a golf course. My dad loved golf. He still does. Desperate for me to return to Barrow, but I'm settled in Chester with my family. So, but it's a lovely part of the world if you want to go. The most rewarding aspect of my job is the multitude of surgeries that I perform. So patients present with many different problems, and most of the hand and wrist surgical procedures we perform are very successful. They're probably the most successful procedures that are performed in surgery. So, carpal tunnel syndrome, for instance, when it's dreadful nerve pain which is disrupting people's sleep, a fairly straightforward operation under a local anaesthetic provides immense relief, and those patients are incredibly grateful for that. And similarly, the Dupuytren's disease that we've been talking about, many of the procedures now are local anaesthetic procedures, so quick recovery, and the patient's just so grateful that they're able to return to a level of function which they didn't enjoy before because of the condition. And it's across all age ranges as well. So the very young who have got high demands to the older patient who is looking forward to enjoying retirement, and that's very satisfying.